Hi everyone, I hope you're well. Today we are going to discuss about wax up, in particular palatal surfaces of upper anterior teeth when you're doing wax up or when you're requesting wax up from your technician. I was interviewed by amazing Jazz Gulati on his Protrusive Dental podcast, and many dentists who visited that podcast has asked this question. So I'm trying to clarify their question into this short video. By the way, if you haven't subscribed to his podcast, Jazz is an amazing guy, and I would highly recommend if you subscribe to Jazz Gulati's Protrusive Dental podcast. So let's get to it. When we are doing full mouth reconstruction and we are sending technician to carrying out wax up, if you're not doing it by yourself, then you need to give technician particular instruction, because when we are reconstructing patient's mouth, sometimes the surfaces of the upper anteriors cannot be like a natural tooth. We need to create a small ramp so you get a 90-degree almost angle when the lower incisors meets the upper incisor. Otherwise, what will happen is all the load will go into not into 90-degree sort of axial loading, and you'll get more sort of a divergence loading, and patient's teeth may start flaring. Now that's the hypothetical risk. I have seen patients with not appropriate loading and teeth are still fine, but there is a risk that patient can have flaring, especially if you're a dialing patient. If you're planning to do a dial treatment, you must make sure that the lower anterior is sort of loading onto a flat surface on the palatal surface of the upper anterior. So what do I mean by that? So let's look at the photo. In this photo, one of my students has sent the technician for a wax up because he couldn't do the wax up. He just asked technician to do the wax up for him for full mouth reconstruction. And this is what he got. I have adjusted patient's upper right one. So in this photo, you will see the left one. And I've adjusted that so you can see the difference. So if you look at in the photo, right side tooth, which is upper left one for patient's mouth, that's how technician did the wax up, and technicians like to make the teeth look more natural on the palatal aspect. However, if you look at on the left side tooth, you can see a nice ramp which looks something like this when you look at it at the angle. And this is really important because again it helps you when the lower teeth contacts the upper teeth into getting into that axial loading. And again, you can see in these photographs how you want that palatal surface. Now, many people have asked me how much thickness you want, how thick it needs to be. I wouldn't want the lower incisor just meeting right at the edge of the ramp. The reason being that when you are opening patients up, and let's say patient relaxes their jaw more than your CR position, then there is a hypothetical risk that patient will slide off the ramp and won't be able to contact there and then just go more palatally. And then the whole point of making ramp, it becomes useless. And that's why you want maybe a 0.5 millimeter or millimeter space palatal to your contact of the lower incisor. So if you look at this photo again, if you look at exactly the arrow where it's pointing, you want your lower incisor contacting there, and you have some more ramp still left. So if patient's jaw moves a little bit back, then you still have some tooth which is supporting the lower incisors. So I hope that makes it a little bit easier. Feel free to send this particular photograph to your technician and explain them how how you want your teeth to be. I understand that this is not a natural shape. However, this is biomechanically the best shape we can make when we are reconstructing patient's mouth, and we want to avoid issues of flaring teeth or inappropriate loading of the teeth. So again, feel free to just take a screenshot of this and send it to your technician so then they can understand what you are trying to explain. Otherwise, many times it's out of technician's imagination as to how you would want your palatal surface to look like. I have created a Facebook group in order to discuss these issues, because many times just having a video it's not enough. Sometimes people want to ask me more questions and discuss some cases. So if you would like to be involved more in discussing about full mouth reconstruction, following me, then join this Facebook group called Full Mouth Reconstruction for GDPs. It's on the Facebook, or you can use this QR code link to join the group. And I hope this video was useful. And again, as I said, if you want more information, join the group and ask me any question you like, and I hope I will be able to help you with taking your journey upwards in full mouth reconstructions.